And Brian was a key factor in getting Gastonia and Springfield again to work together, and we had trips back and forth, and the more important message of being able to relate and respect each and every one of us. So, to Brian, you're up there in heaven now, and giving the Red Sox some good luck moving forward. So if we could just have a moment of silence, please. Thank you very much. You know, we're in the holiday season, Christmas, Advent, and we're also at a critical but hopeful time. And speaking with Dr. Kerouac Friday afternoon or early evening, and about hope. And hope makes people believe. Hope makes people move. And hope makes people do. And we need that more than ever. Even though we're in the midst of a spike and a surge, there is daylight at the end of the tunnel, and the medical experts will indicate that, but we cannot and we must not let our guard down. Speaking of the numbers, total confirmed COVID cases since this ordeal has started is 7,730. Due to the spike and surge, we're giving you weekly numbers now. And this past week, we had 1,168. Just for December, 904. We continue to deliver to our senior citizens who are homebound. Those meal deliveries continue to go out. We continue to work with Governor Baker to stop the spread, and AMR, Patrick Leonardo, Director of Operations, who was here. And I'm sure that Commissioner Helen Carlton Harris and Dr. Kerouac and Dr. Roos will give you an update pertaining to the vaccine prep work that is being done, or continues to be done now. We cannot stress to you enough about getting your flu shots. On the deaths officially, we have to wait for the Maven system, but we stayed status quo until it's officially reported. 145 total. White is 62 at 42.8%. Black is 32 at 22%. Hispanic is 47 at 32.4%. Asian is 4 at 2.8%. The majority of these cases, deaths now are coming from the residential area, 87 in residential, 58 in long-term care facilities. We had some great donations made, and I want to thank Dan and Jan Roulier of Roulier Building Associates, my old friend and mentor, Judge Hurley, Mayor Hurley, had reached out to me with Dan, and he wanted to give back to the community, and he wanted to have a clearinghouse type give back, and most generous, $25,000 donated to the Food Bank of Western Massachusetts, Andrew Morehouse, which generates 100,000 meals to our families in need. In turn, Dan said, Mayor, I'd like to put a challenge out there to our very generous and philanthropic business community, and we did, and he did. And late Friday, a reach out came from Mike Crowley and his lovely wife Beth. They're donating Crowley Appraisal Associates, Real Estate Associates. They're donating $12,500. And in turn, Dave and Kate Weeks of Kelly Fredette Lumber, right in East Long Meadow and Red Over Line, Connecticut, $12,500 for another $25,000 to the Food Bank of Western Massachusetts. So that's another 100,000 meals. So 200,000 meals going to be given out to families in need. So again, to Dan and Jan Rulier, thank you so much. And to Mike and Beth Crowley, and to Dave and Kate Weeks, thank you so much for your belief and investment in the city of Springfield, but more importantly, the human spirit. When we talk about long-time holiday traditions, Toy for Joy, Salvation Army, the Republican, priceless the smile you put on kids' faces for toys and gifts. So please, if you can, no donations too small or too large. So that's another special charity, Toy for Joy, the Republican and Salvation Army. There are many, but we need to help them out. As you know, I announced last week, it'll be my third police and community relations town hall, town forum with Judge Roderick Ireland. And again, he likes to do them on Saturdays. That's a Saturday, December 19th from 10 to 12. Any and all are welcomed as we continue to move our police department forward and continue to strengthen our community relationships. Lieutenant Governor Polito, we're working on step forward to give some extension to bright nights, and I think it's well warranted, and I appreciate Judy Matt and DPW and police and Parks Department, Pat Sullivan, to bring some Christmas or holiday spirit joy to young and old, that we're able to extend it to 9:30, and I think that's important. The tradition will continue in Court Square. The nativity scene is already up there, but with Rabbi Kosofsky, the celebration of Hanukkah, I will once again light the menorah this Thursday at 4:15, late afternoon, early evening. Commissioner Helen Calton and I will name the new director of the Office of Racial Equity this week, so stay tuned for that. Commissioner Helen Calton and I also a grant about $20,000 to the Mental Health Association. The doctors have spoken about that, as is Helen. Mental health is in a very difficult situation with COVID-19. We'll be with the Mental Health Association Tuesday. This is to help out people who don't have insurance and give them a path, some light at the end of the tunnel also. As far as just briefly on the cabinet heads, which will be coming up, Springfield Police Commissioner Cheryl Clapper indicates to me they are still down 21 with COVID-19. Strategically, where that Keith Street, Dickinson Street homicide had occurred, the department hit hard over there. It's a trouble area. Drug and gun arrests have occurred over there. That happened this past weekend. We also hit Pendleton Avenue, 3 guns, domestic. This is another person who's out. This person's on the DA Gallooni's high-risk offender, and somehow the courts let them out. Northampton Avenue, again, was hit with gun arrests. And on a good note, the local 364 IPO, Brotherhood of Police Officers, are going to be donating, and Commissioner Clapper was speaking at thousands and thousands of dollars to charities this week. Commissioner Calvi indicates that he is down 13 with another 5 pending. Superintendent Warwick indicates to me on meals that we're now over 4.6 million meals served, nearly 4.7. That's breakfast, lunch, dinner, snacks. Over 102,000 went out this weekend. Superintendent Warwick will speak about the town hall. We're doing a second town hall. That's December 15th to get input from the public as we move forward on how we're going to reenter schools, as long as it's safe and sound public health. And we'll also be addressing that DESE letter about the special ed children and students. We'll also give you a little more an update, the attendance on remote, which we've been ahead of the curve, and so noted in the Commonwealth, 91.5%. We'll give you an update on winter sports. The MIAA is okayed winter sports practices start January 4th. and he'll speak a little about the Mcas delays that'll occur. DPW and Director Signoli and I really want to, again, thank the patience and understanding of our residents. DPW is down 3 with COVID-19, but they are down a number of drivers, and that in turn has delayed us on yard and leaf pickup. They will continue to pick up until the weather does not permit. So thank you for your patience on that. We are down drivers. We still are in need of snowplow drivers, which is a issue going across the Commonwealth. And construction will continue. I think Director Signoli will state that they'll speak about possibly extending it going into next week, depending on how the weather goes. Finances, I'm down for FY21, $2,083,000. Since the start, $6.9 million. Deficit spent $7.6 million. Total spent with grants and deficits, $17.5 million. With facilities and parks, Director Sullivan is down 4 with COVID-19, 3 pending tests. Director Sullivan will be doing a video presentation on the cleaning procedures we're doing, and really specifically on the Iwaves, the state-of-the-art that we're putting into especially our schools and our buildings. And he'll speak of that as they continue to retrofit our buildings and schools. Sear Arena is to be determined when that can reopen through Director Sullivan and Commissioner Helen Colton Harris. Echo Dev Tim Sheehan will give you an update on the $8.4 million we've put out, the money that's been deployed, but he will echo a clarion call that I put out there too from the federal government level. We have no more money. We need this stimulus package, this relief package to come ASAP to help out our business community. So we are hopeful that something can get passed, not only temporarily in this lame duck session, but moving forward with the new administration under President-elect Joe Biden and Vice President-elect Kamala Harris. The unemployment rate, Attorney Bill Mahoney indicates to me, in the U.S. has gone down from 6.9 to 6.7. Solicitor Pakula has given me his usual legal updates, so we appreciate that. And now with that, let me turn it over to our medical portion of this update, and I will now bring up the President and CEO of Bay State Health Systems, Dr. Mark Kerouac. Thank you.
Well, good morning, everybody. Thank you, Mr. Mayor. Really appreciate this opportunity, and as always, we appreciate the cooperation of your whole team. COVID-19 continues to spread rapidly in our communities and across the country, and unfortunately, it's picking up speed. We now have 67 million cases globally, 1.5 million deaths. The United States is closing in on 15 million cases with over 282,000 deaths. We're seeing record numbers of daily new cases, 200,000 a day, and record numbers of deaths, 2,800 a day. In terms of reference, 2,400 brave Americans died at Pearl Harbor. So more patients die every day from COVID now than died at Pearl Harbor. Many states are reporting that their hospitals are at capacity, and they're going backwards in terms of reopening, such as the lockdowns in Southern California. Nearly all areas of the country are seeing rising case levels, and of course that puts a strain on our testing capacity and our PPE. Massachusetts has now seen 247,000 cases and 10,700 deaths. We're now at about 4,000 to 5,000 new cases a day and over 40 deaths a day, and that's a twofold increase in the last couple of months. Hampden County is now a hot spot. We've seen over 16,000 cases of the virus across the county, and the rate of new cases is up dramatically. Let me give you a sense of how much it's gone up. You'll remember in the good old days during the summer when the state first came out with the color-coded map, we were quite proud that Springfield was in the green zone, and it was quite an accomplishment for a large city. At that point, we were seeing 4 cases per 100,000 population, averaged over 14 days, 4 new cases per 100,000 every day. And we were a little disappointed when that crept up over 8 cases per 100,000 because it put us in the red zone using their old system. Now, across the whole county, we're at 48 per 100,000. That's 6 times higher than where we were when Springfield was in the red zone under the old system. It's the second highest rate in the whole state of Massachusetts, only slightly behind the North Shore, Essex County. So Hampden County is a hot spot. Hospitalizations are over 1,400 in the state, and you've probably heard that there are 2 field hospitals opening in Worcester and in Lowell. Bay State Health this morning had 136 patients with COVID in our facilities, 124 at Bay State Medical Center, 12 in our community hospitals. 13 patients are in critical care. Bay State Medical Center now holds the dubious distinction of having the most COVID patients of any hospital in the state. We have been postponing elective surgeries and procedures on a selective basis when we know from the providers that the delay will not harm the patient. We're doing our best to keep open areas where closing down would have no impact on hospital capacity or where the staff from those areas couldn't be deployed to the inpatient area. As the mayor indicated, the vaccines will soon likely be gaining approval. The Pfizer vaccine goes to the FDA approval committee this week and Moderna next week. We're awaiting the state guidelines on the priority list of recipients. I understand that the amount of vaccine to be allocated to the country and to Massachusetts, therefore, is going to be somewhat less than we first expected. We have at Bay State developed an operational plan to open a vaccine distribution center for priority individuals, but given the numbers of vaccines we'll be getting, that likely will be healthcare workers only, and among healthcare workers, only those that are in the direct line of fire working directly with COVID patients. We're not going to release this plan until we know more from the state as to what we're going to receive and what's going to be expected of us. In other words, will we be expected just to take care of our own employees, or will we have broader responsibilities? So we do need to align with the state guidance. So as I've said, the amount of virus in the community, and particularly its rate of rise, is alarming. Remember, virus levels do not grow steadily. This is not like water in a sink gradually coming up at a predictable rate. Viruses grow exponentially, faster and faster with more and more virus. In November, the numbers at Bay State Health doubled, and then they doubled again. They went from 30 to 60 to 120. If we double again in December and then double again, just as we did in November, we will not have the ability to care for patients with COVID and non-COVID illnesses. That's certainly not all that would be seeking our services. Some hospitals in the United States are already there. The hospitals of Bay State Health have been around for over 100 years with dedicated, caring, and expert staff. They have never failed to meet the needs of our communities, and I don't want that to happen now. Our teams have been doing an exceptional job managing the brisk increases in patients in our hospitals, and I don't want to push them past their breaking point or past their capacity. So I'm going to suggest some things that you in the community can do to help us so we don't get to this crisis state. What's happening now in our communities is not working to slow the rapid growth of the virus, and everyone has a role to play to get up our game and to slow the spread. We need to limit what we're doing and where we're going in Western Massachusetts. Recommit to basic protections and keep it up for about 3 months until enough people are vaccinated and case levels start to fall. My advice today is consistent with the CDC. Last week, they issued new, broad, and more restrictive guidelines in response to the rapid growth across the country. We need to take those guidelines seriously. Dr. Birx of the White House Coronavirus Task Force put it quite clearly. You should not be in an indoor space with people who do not live with you if masks are not being worn. I'll say that again. You should not be in an indoor space with people who don't live with you if masks are not being worn. To me, this means we should avoid indoor dining in restaurants. It means not visiting family and friends who aren't in our immediate household without masks and distancing. Our hospitals are full of people suffering from this virus, people who thought it would not affect them and their circle of family and friends. With so much virus around, you should assume that every indoor space you enter has someone there who's shedding virus without symptoms. So choose wisely where you go and for how long you stay there. Ask yourself, is it worth it? Is it worth the risk to bring the virus back home to those you care for and care about? Masks can reduce the risk a lot, but they're not 100% protective. Because of this, the CDC has advised that we avoid any non-essential visits to indoor spaces. This means we should limit our time for any indoor activities outside the home and focus on things that are essential, like going to the grocery store or doing your job. Masking, distancing, and hand washing are a set of practices that clearly lower risk. They don't lower it to zero, but they lower it a lot. And it really makes me sad that some people still want to debate this. The data is clear, and the CDC has reaffirmed it. Our country was built on individual rights, but nobody has the right to harm another through carelessness. The suggestions that I'm giving for more restrictive activities for our communities in Hampden County are not recommendations I arrived at lightly. I know they'll impact the livelihoods of my neighbors and my friends. We need to continue to support, say, our restaurants the way we did last spring with curbside pickup, delivery, and gift cards. I realize I don't make the rules, but I am here, as I have been so many times before, to share what we're learning about this virus and how it's impacting our lives. It's not an easy time for any of us. I sincerely hope we can each decide to sacrifice a bit of our personal liberties for the good of all of us. The vaccines indeed are coming, and the pandemic and these terrible restrictions will be a memory sometime in 2021. But we need to try to reduce suffering and death for our families, neighbors, and friends for a few more months before better days come. I would be grateful for any efforts you decide to make. So thank you, Mr. Mayor. Appreciate it.
Thank you, Dr. Again, please heed that advice. I know it's difficult, but we're right around the corner. And I just wanted to clarify, Commissioner Helen Carlton-Harris indicated, I mean, I guess it came in late Monday and Tuesday, the 145 and the deaths, there was an increase, I believe, technically of 7. Again, our thoughts and prayers and sympathies and encouragement go out to all the affected families and friends. So I want to clarify the 145, which I believe prior was 138. So that's reflected in the total number and the numbers I gave you of the white, Hispanic, black, and Asian. I want to thank the McQuaid Ireland family. They get masks sent to me all the time. They had a mask made for me, so I'm wearing that today. And now I want to bring up Dr. Robert Roos, the Chief Medical Officer of Mercy Hospital Trinity Healthcare.
Good morning, everyone. Thank you, Mayor, and good morning. And thank you to your team for all the continued leadership amidst this surge, and a thanks to the media as well for the continued reporting on the issue that has not abated over the last year. I also want to thank Dr. Kerouac for his comments, and I stand with him with that very sound recommendations and guidance to you all. To the entire community, it is clear that we remain at a tipping point. The mayor started the morning with the importance of hope, and there is an incredible amount of hope that rests in the future with a safe and effective vaccine. But the urgency in this moment has not lessened at all. The need for us to take precautions to reduce the numbers of infections has not subsided in any way. And the concern for our resources, both in the hospital and throughout the community to care for you, remains high. It's actually alarming to me now, a year later, after the first diagnosed cases of COVID across the world, that despite all of the learnings and all of the incredible effort and all of the advances in therapies, that we continue to set new records week after week for hospitalizations, infections, and deaths all across this country. So if there has ever been a time to heed the warning signs and to follow the advice, now is that time. As was stated, we will hit 15 million confirmed infections in the United States tomorrow. There are now more than regularly 200,000 new infections each day, over 100,000 people hospitalized as of this moment, and 2,000 to 3,000 deaths per day from COVID. The numbers of new infections continue to rise. They've risen by 12% across the country over the last 2 weeks. Hospitalizations have risen by more than 27%, and deaths have increased by almost 50% in just the last 2 weeks alone. We've tracked the epidemiology of this virus, and we've seen the first curve and then the second curve, and now we're into that third wave of new infections for which we have not yet hit the peak, but yet we are already twice as high as the peak of the second wave. And just this week now, we are going to start to see the large numbers of infections that are undoubtedly related to gatherings around the Thanksgiving holiday weekend. Here in the Commonwealth, unfortunately, our trend is not any better. The advantage that we had here in Massachusetts was that our low point was a bit lower than perhaps some other states due to the great work of many people over the first surge and throughout the summer. At one point, we were seeing just 150 to 200 new infections per day across the entire state. Unfortunately, now that average rate is over 3,000, and we've seen more than 5,000 new infections a day, several times over the last week. We are going to hit 250,000 total infections today here in the Commonwealth of Massachusetts. The test positivity also continues to rise. It's now over 7% when you take out the repeated tests that are done for those affiliated with higher education. And as we could have predicted, hospitalizations are continuing to rise day over day, with now over 1,300 on average in hospitals across the state, and deaths have increased to over 40 per day. Across the state, regions are escalating into a second tier of resurgence that impacts and highlights the fact that there are limitations and concerns around access to inpatient ICU or medical surge beds, and limitations on the ability to transfer within hospitals when needed. And now 2 field hospitals are being stood up. At Mercy Medical Center, after a few weeks of relatively stable numbers of hospitalized patients, this past weekend we saw a significant uptick. And as of this morning, we now have 26 patients hospitalized with COVID, 4 of whom are in intensive care. We also continue to see rising numbers of people being tested, rising numbers of those with positive tests, and an increase in the test positivity rate, for which this past week, for tests performed through Mercy Medical Center and affiliates, was at 10%. My concern is, however, that this is only going to go higher, unfortunately, unless we take some very significant action. It's important to recognize that at this juncture, despite the fact that the coronavirus has many unique properties, and the fact that we've all changed things this year in response to it, there are many things about this that are very easily predictable. We know that if there's a person that has the coronavirus, whether they have symptoms or not, the risk that they transmit it to someone else goes up significantly based on a few key factors: how close they are to someone else, whether or not they're wearing a mask, how long they spend with someone else, and what the ventilation is like in the space in which they are. So we know it is very predictable that the cold weather has brought more people indoors, particularly to eat and drink and commiserate, which we know is associated without wearing masks, is in close distance, and occurs over a significant period of time. It's guaranteed that that will lead to more infections. It's just the math and the science of it all. Then we know that if there are new infections, that there will be an increase in hospitalizations, typically a week or two later, and then the increase in hospitalizations will lead to an increase in deaths. There are 0 situations in which the risk of transmission is absolutely 0, or the risk of acquiring COVID is 100% guaranteed to be risk-free. But we know that the precautions work. And we know that there are areas and situations that bring significantly increased risk compared to others that we need to be very cautious about. Those that Dr. Kerouac mentioned, those involving indoor spaces where people gather without masks, with individuals outside their household. And the reality is that we still have a very long way to go, probably more than 6 months for most people, perhaps 3 to 4 months for some others. But it's going to be a while until vaccination is widespread enough to fundamentally change the way that we all interact. And so I could not reinforce more that this is a very critical time, and it's time for us to rally together. I will say, in reference to hope on the vaccine front, there is some promising news. We know that there are 2 very good vaccines from Pfizer and Moderna that are expected to get authorization from the FDA in the coming weeks. They've shown a high efficacy rate after being tested in tens of thousands of individuals in the US. The side effects appear to mirror the side effects of most vaccines that are common. And we know that from the CDC and the Massachusetts Department of Health that healthcare workers and residents of long-term care facilities will be among the first groups to receive or be eligible for the vaccine. So we at Mercy Medical Center, as our other hospitals, are preparing to be able to distribute and administer a vaccination campaign of our own colleagues. The governor has said that Massachusetts is likely to receive about 60,000 doses in the near future and possibly up to 300,000 by the end of the year. We at Mercy, just like others, we have not yet heard which vaccine we will receive, how much we will receive, or when exactly we will receive it. But we have developed the plans. We have acquired the storage. We have discussed the procedures for handling, for security, that we could manage either the Pfizer or the Moderna vaccine, whichever one we're allotted, and that we will be ready to begin vaccination of our colleagues within a couple days after receipt of the vaccine. And we will be engaged in a program to try to vaccinate as many of our colleagues in the first 7 to 8 weeks while manufacturing and distribution ramps up. That effort will include education. It will include the administration of the vaccine, tracking of the vaccine so that individuals will receive their second dose at the allotted time, reporting of adverse effects. And this is a significant undertaking, but one that could not be more important. So there's a few points that I also just want to make for the general population, just to clear up if there's any misconceptions. First, the evidence is clear so far that what we have, that these vaccines are very effective and they can prevent individuals who are exposed to the coronavirus from getting sick with COVID. Secondly, we know that the mechanism of action of this vaccine utilizes a piece of genetic material that's wrapped in a lipid bubble, so to speak, that prompts our body to develop an immune response. It does not use a live vaccine. You cannot get COVID from receiving this vaccine. The process to develop immunity can sometimes create symptoms as the body is generating antibodies in an immune response that can be commonly experienced with many vaccines, like soreness in the arm or headache, or even a fever or chill. But it's clear that this is not from the virus itself. This is your body demonstrating an immune response to keep you safe and protected. Accordingly, receiving a vaccine will not mean that you would test positive for COVID on a viral test. It's possible if you develop antibodies that you could develop a positive result on an antibody test, but never to a viral test. And lastly, it is thought that even for people that have recovered from COVID in the past, that there still could be some utility and value in receiving the vaccine. That's because we don't yet know how long the immunity can last from a natural infection, and that there is still a potential risk of reinfection. And so I encourage all of you in the community to consider these facts, ultimately when you're beginning to evaluate the vaccine when it's available and eligible for all members. There's no question that vaccination really is the key for us to return to the activities that we know previously. This is also very predictable. If there's a large enough population that receives an effective vaccine, then the infection rate will go down in the community, and then so will the hospitalizations, and so will the complications and death. We as a community, as public health and medical experts, we will continue to follow the infection rate, not only the vaccination rate, but the true infection rate and the other key metrics before we would ever consider relaxing those public health measures. And for now, it's very clear, as we've stated, that it's critical that we continue to reinforce and double down on those currently. This past week, the CDC issued a weekly report that highlighted the 10 key public health guidelines that are essential to reduce transmission of the coronavirus and preserve life and health. Those guidelines are the same ones that we've been talking about for 9 to 10 months, but they are reinforced now with more evidence, and it has never been more important to follow those. They include universal masking, physical distancing, avoiding non-essential indoor contact, increasing testing and isolation, contact tracing, safeguarding the most vulnerable among us, including the protection of essential workers, postponing travel, increasing the ventilation systems and reinforcing hand hygiene, and finally, providing widespread, accessible, and equitable access to vaccination. So at this point, save that 10th one, which we're working on furiously, we have all the tools. Together, we can make a difference. I urge you to please think about how you will continue to support our community by taking those precautions, by doing things differently now and throughout the entire winter, not only to keep yourself safe, but for our colleagues in the hospitals, for our essential workers, for our businesses, our schools, and each other. Thank you.
Thank you, Dr. Roos. And Dr. Roos and Dr. Kerouac will take questions. I know 22 News here. I saw Katrina Kincaid and Nick Oresco, Eric from Western Mass News, and Paul Tuttle Radio, and Mr. Safransky. So any questions or comments you might have, Dr. Kerouac or Dr. Roos? Paul?
Dr. Kerouac, at what point might you reach capacity if this rate of growth you outlined continues?
Well, I mentioned if we doubled and doubled again in December, so if we went from 120 to 240 to 480, looking at the demand for other non-COVID related illnesses, we would be trying to find other places for patients. Right now, what we're doing is redirecting some of the milder care to some of our community hospitals that have lower levels of occupancy, and we're dialing down some of the cases that can be postponed. Not all of them can be postponed, so a routine hernia operation, for example, might be postponed, whereas a lump for breast cancer might not be.
Questions or comments?
Doctors, there was an article in the Atlantic recently talking about how the percentage of people who were actually tested, overall capacity of people who were actually there for COVID had actually fallen, and that was a bad sign because it suggests that people were not being cared as cared in the hospital as readily as they might before people being sent home, and whereas maybe 6 months ago they might have been admitted to the hospital. Is that phenomenon happening at all in this area? And is it necessarily entirely just, we can't afford to have the space, or is there some circumstances where it isn't necessary with them that it might have been at a pretty earlier time?
So a number of things have changed on how we care for patients with COVID. Milder cases can be supported with oxygen therapy at home by our home health agency. We've learned how to do that. Because of the effectiveness of treatments, the length of time somebody spends in the hospital has shortened too. So while the count of the people in the hospital at any given time is just a single slice in time, it really is a flow problem. We're sending more people home sooner, curing them, and fewer people are getting stuck for weeks and weeks with those long periods of convalescence that were so common in the spring.
I echo the same thoughts. Yeah, I don't have anything else to add on that. It's the same trends. Yeah.
And there was also, and I'm sure everybody, both of you have heard, there was some criticism of Governor Baker over the weekend regarding whether or not anything needs to change. In particular, he had said that the situation is different now than it was in the spring because there are so many fewer people in the ICU versus regular beds. Do you agree with that assessment that the difference is that there are so many fewer people? The numbers appear to be true. I looked it up, there's over 1,000 people in ICU back in the spring. There's nowhere near that now statewide. Do you agree with that assessment from the governor?
So I would agree that there are fewer cases that are ending up in intensive care and on mechanical ventilation. And oftentimes the staffing for an ICU or the resources to take care of patients that have the most intensive level of care tends to be the resource that's the most challenged because it is the most specialized, and there's fewer people that are trained to be able to provide that level of care. At this point, we are managing those cases well. I think that does not eliminate or obviate the concern that while there are maybe fewer cases at the sort of top of the pyramid in terms of the level of intensity of care, that there are not concerns about capacity for patients overall, those at the intermediate levels of care or those requiring lower level but still hospital level care. And so to think that to make the correlation that just because the intensive care units may not be experiencing the same surge, if you will, that does not strain the hospitals in similar ways, I think would not be looking at the picture comprehensively. But it is a different surge this time around, certainly because of the concerns largely regarding available staffing and resources throughout the entire continuum of care.
Well, yeah, nothing much added. Yeah, the governor's correct. About 25% of our patients wound up in critical care during the spring, and it's only in the 10 to 15% range now. And as Dr. Roos says, the crunch is on routine beds, not on critical care beds now.
And just one final question, you may not know the answer to this, but I'm just curious, because I know you do speak to other hospitals in Western Massachusetts. The state's dashboard has seemed to indicate there was a decline in the number of overall beds in Western Massachusetts, overall ICU beds. Is there anything to that, at least as far as your aware? So I know I'm not looking at percentages. I realize those have been.
In other words, the denominators were dialed down.
Recalibrated.
Yeah, they basically recalibrated some of the data that we were sending into them. I think, to me, the state tries as best they can to present a slice in time, but we all know that it's kind of a fluid situation. If we basically decide to hold back on a case that can be postponed, that opens a bed that otherwise wouldn't have been occupied. So to us, it's a much more kind of fluid day-to-day situation. Who's going home? Who's coming in? What's the demand? What's the, you know, the capacity of beds in the community hospitals or at our colleague hospitals? We talked about this just last Friday as a group of CEOs from Western Mass, and, you know, we're trying to make it all work, but it's a day-to-day kind of situation.
Yeah, I'll just highlight that. As part of the resurgence planning, each region has leaders that get together and now are meeting twice weekly. And so as a way to sort of recalibrate, as Dr. Kerouac said, and I would agree with, the numbers may change periodically, and it depends not only on facility size and capability of actual beds, but on available resources to be able to staff and care for patients in those areas.
Because I mean, we're talking about like 400 beds just vanishing from the data. That's not.
Trust me, they didn't go anywhere.
So I mean, we shouldn't be worried that suddenly our regional capacity is just plummeted over the course of like 4 days.
Our region.
And again, capacity, I mean, the beds exist, they would have filled or unfilled.
No, I understand.
Okay.
As I had mentioned before, let me give you a picture of what happened last time. Bay State Health is a 720-bed hospital. That's our licensed capacity. As a result of using alternative spaces in the spring, we swelled to 850. We actually shut down elective surgical cases, all elective surgical cases, like total joint replacements, et cetera, that would have occupied those beds. And so we were able to accommodate up to 300 COVID patients, although we only got as high as 180. And at the same time, we had 400 non-COVID patients who were emergencies for other reasons. And so it's very fluid. The state tries to make this, you know, to give numbers that they can put on a chart. And I think they give us a rough sense of where things are at. But none of us obsesses about these numbers. I mean, they're all kind of shades of gray for us.
Any other questions? Dr. Russo, do you want to go?
Nope.
Any other questions from the media? 2240, Paul? No? Okay, to Dr. Russo, Dr. Kerouac, thank you for what you and your team continue to do. And stay healthy and stay safe. Thank you so much.
Thank you.
We'll now move to the public health component of the city. And our and my Dr. Anthony Fauci, Commissioner Helen Carlton Harris will give her report.
Thank you, Mayor. Appreciate it. Let me begin with the charts and let me begin with the data. I want to, first of all, start by thanking Dr. Kerouac and Dr. Roos and Bay State Health and Mercy Trinity Health for their support for our region and everything that they do to support not only the city of Springfield, but this western region. We are very lucky to have two outstanding health systems in our geographical area. I'm going to start with the COVID-19 confirmed cases on November 29th to December 5th. I think you can see the numbers in front of you. Sunday, 104, Monday, 160, Tuesday, 45, Wednesday, 197, Thursday, 193, Friday, 173, Saturday, 296. We have never seen this level of infection in the region or in the city of Springfield. These numbers outpace the numbers that we had in April and May. Looking at the confirmed COVID-19 cases for the past 3 weeks, you can see the week of November 15, 632, the week of November 22nd, 675. Last week, we had 1,168 cases. That is an increase from last week of 493 cases, which is a 42% increase in the cases that we had from last week. The graph, the line graph, 2020 confirmed COVID cases by month, really does tell the story of this virus in the city of Springfield to date. In January and February, there were 0 cases. In March, there were 54 cases. In April, 1,069 cases, and then in May, 1,300 cases. Those were our 2 peak cases in our city, and then you see in June, 289, July, 328, August, 182. In September, we started to increase, 318. In October, 867. In November, 2,667 cases, which is a number, again, that we have never seen before. That number is double the number that we had in May when we were at our peak. In looking at the cases by age group, this is just last week, 0 to 10, 105 cases, 11 to 20, 163 cases, 21 to 30, 246 cases, 31 to 40, 198 cases, 41 to 50, 169, 51 to 60, 154, 61 to 70, 91 cases, 71 to 80, 27 cases, 81 to 90, 12, and 90 to 100. There were 3 cases in that age group. If we look at the donut in terms of the age groups, we still see the prevalence of the virus, 75% is under the age of 50. 30 and under represents 44%, 31 to 50 represents 31%, and 51 and older represent 25%. The zip codes, 01103, 24 cases, 04, 195, 05, 110, 07, 130, 08, 178, 09, 212, 18, 94, 19, 84, 28, 23, 29, 49, and 51, 65. You can see the percentages on the pie chart that has the cases by zip code. 04, 17%, 05, 10%, 07, 11%, 08, 15%, 09, 18%, 01118 looks like 8%, and then 0119 is 7%, 28, 2%, 29, 4%, and 03, 2%, and 51, 5.8%. We look at the cases by race. Again, that unknown part is what really concerns us because we don't have data for the unknown portion, which is 31%, Black African American, 16%, Latinx, 25%, and white, 26%, and Native Hawaiian Pacific Islander, 1%. Again, these are the cases from last week. And so the message is very clear at this point. We must behave as if everyone we come in contact with is COVID-19 positive. I will say that again. Whatever setting you are in, whoever you are with, wherever you are, you must behave as if anyone in that environment is COVID-19 positive. The confirmed cases in Hampden County is 17,982. The deaths amongst confirmed cases is 926. Springfield cases, you've heard, 7,730. The deaths are at 145. As of December 5th, the positivity rate for the Commonwealth of Massachusetts was over 7%. For the city of Springfield, it is over 10% at this point. What we are seeing is something that infectious disease and public health professionals told us back in June we were going to see, that we were understanding that as we went indoors to gatherings, that we were going to see our cases increase. We were told after the Thanksgiving we were going to see a surge. That is happening now. That was predicted because after Memorial Day, after the 4th of July, after Labor Day, there were increases in cases. Thanksgiving, because we are indoors, has created a crisis. We are in crisis. And I think it's important that each one of us recognize that the crisis is in our homes, in our living rooms, in our stores. It is around us. Community spread is here. The infection is raging, and individuals are dying and being hospitalized and at home suffering because they are sick. And so what we are seeing is clusters. Cases are in large and small gatherings. Those of you who are gathering indoors, the cases we know are coming from those gatherings. We are seeing small clusters amongst our hospitals, obviously, because people are being hospitalized. We're seeing clusters amongst college students. We're seeing clusters amongst long-term care facilities. We're seeing clusters in congregate living facilities. We're seeing clusters in our homeless population. So the message is there are clusters that are happening in every setting across our region. Again, behave like everyone you come in contact with is COVID-19 positive. I want to remind the businesses that it is important and mandated that you report any positive COVID-19 entered person to the Board of Health in the town that you reside. We want to be able to do the necessary work as far as contact tracing is concerned and alerting individuals who need that information. We are responsible for alerting boards of health in other municipalities if individuals who work in Springfield don't live in Springfield. And we are heading into the Christmas holidays, and each one of us should be nervous, each one of us should be scared, each one of us should take this seriously. This is no time for us to practice apathy. We need everyone involved in this effort. So the Christmas holidays are coming. Healthcare workers, I hear from my friends often who work in acute care in hospitals. They're tired, they're weary, they're afraid. They have families at home as well. They care for the patients because that's what they've sworn to do. But when they get home, they worry about their families and how to take care of them and not to spread the virus to them. They worry about themselves getting sick. They also understand that there sometimes are not enough workers on each shift because of a shortage in staffing in some cases. They are giving compassionate care. These individuals are sitting by bedsides, holding hands, and watching people die because their families can't be with them. We owe it to them. If no one else, we owe it to them to make sure that we are taking the necessary precautions so we can keep our workforce, our healthcare workforce stable? What will happen if they're not there? Who will care for the sick if they're not there? If their staffing capacity is not where it needs to be, we are all going to suffer and not have the care that we need. Please, I'm asking you, I wonder, what will it take to get your attention? What will it take to get the attention of a public? Is it not enough to know what the deaths are? Is it not enough to know the data I show you every week? Is that not enough? What will it take in order for individuals to wear a face covering, to wash their hands, to watch their distancing? What will it take? Will it take someone to die in your own family? As my good friend Daryl Bumpy Gibbs, who gave me a video of his mother. 1 year ago today, his mother was laughing and joking at their Thanksgiving dinner. She was enjoying living. She is not living right now. That family is suffering. And so you have the power. We have the power to be able to turn this around. Testing, we continue to do. AMR has tested 63,432 individuals. 27,627 of those are Springfield residents. The positives is 4,844. That is not just Springfield residents, but that is the overall positivity. We are working with the State Department of Public Health to think about vaccines and think about how we as a municipality and a Board of Health will be able to support the effort to make sure when the vaccines are available for the public that we're able to get it to the public in a way that is consistent with our emergency dispensing systems plans. There is a distrust in the community. The latest data tells us that only 58% of the individuals who were asked would take the vaccine today. That is up from 50%, but it's still not going to be good enough. So we need to make sure that we have trusted voices, medical professionals who are talking about the vaccine and talking about how it will impact us as a general population. And so we are in the process of standing up educational campaigns so that we can reach all of the populations. Now, those campaigns will be based on race, ethnicity, language, socioeconomic status. We are not planning to leave anyone out. Our educational campaign is going to be concrete, and it's going to think about those individuals who have the most distrust of the vaccine process. We recognize this vaccine happened really quickly. So folks are thinking, well, this was too fast. But it's not too fast. It's going to be safe, and we are all going to do our best to educate the public to make sure you all are comfortable with this vaccine. Hope, you've heard about hope many times from everyone who has been at this podium so far. Hope is on the horizon. Hope is here, and we believe that this time next year and before, we will all be looking at this and thinking about how we got through this together. And isn't that the goal, to get through this together? Not stand still, not stop, but keep moving through this so that we can get through this together. Again, the power is yours. It is your power. You have the power to turn this around. Very simple things, very simple things. And I want you to remember those hospital workers tired, hospital workers getting up every day, hospital workers sitting by beds, hospital workers crying, having tears in their eyes because they are just frustrated. But what do? They get up every day and do it one more time. And so please, please heed what we are asking you to do. Good public health is going to save all of our lives and make us a better society, I believe, for that. Hope is here. The vaccine is coming. We just need you to cooperate with us. And I'm thanking you in advance for what you are going to do, because I know that you're going to do it, and it's the expectation that you care enough about yourselves, your family, this city, this region, this nation, that you will do what's necessary. Thank you.
Thank you, Commissioner Carlton Harrison. Heed that advice. It still boggles our minds that people make an argument why not to wear a mask or to be cautious. We'll now move into the public safety component of the COVID-19 update, and I'll bring up the Fire Commissioner of the City of Springfield, Bernard B.J. Calvi.
Thank you, Mayor. Good morning, everybody. At the Fire and Dispatch Services today, we have 13 members out with COVID. We have 5 awaiting testing from exposures, and hopefully they have good results, and we'll get them back shortly. It was a smooth past week. We didn't have any major incidents, so everything's going along well, and that's all I have for today. Thank you very much.
Thank you. Thank you, Commissioner Calvi. Now for the police public safety update. On the police side is the Police Commissioner of the City of Springfield, Cheryl Clapprood.
Thank you, Mayor. The police department has 21 currently out with COVID. Fairly busy weekend. Started Friday when we put some emphasis on Keith Street, an area of a recent homicide. The narcotics unit, the C3 units, 3 arrests, recovered an illegally possessed firearm, 600 bags of heroin, crack cocaine. We continue to work on that Keith Street, Dickinson, Belmont area. Sunday at 12:20 a.m., so Saturday night into Sunday, officers responded to Northampton Avenue for a gun call. We located a subject, 19-year-old Edwin Velasquez. After a short foot pursuit, he fled and he threw a firearm. We did recover that firearm and he was arrested. Sunday, last night, 8 p.m. on Pendleton, 3 firearms recovered after a domestic call. We responded to the domestic incident. Subject was arrested. He was assaulting a woman in front of some children. Officers intervened. Firearms were recovered. We don't have his name. He has not been arraigned yet. Domestic arrests, we wait till after an arraignment. Today begins the week of the IBPO, the Patrolmen's Union, the week of giving. The Springfield Police Department and 364 Gives, the charitable foundation of the Springfield Patrolmen's Union, will donate over $20,000 this week to some of the charities that we've sponsored, so we're looking forward to that. Thank you, Mayor.
Thank you, Commissioner Clapprood. Thank you, Commissioner Clapprood, and to, again, the dedicated and brave men and women in blue and our fire services for your efforts. I just, again, we have such a generous philanthropic business community. Dan Ruler just called and said they just received another $25,000 anonymous donation to go to the food bank of Western Massachusetts. Since we put this charge out, $75,000 has been raised in a matter of a couple of days. That makes for 300,000 total meals. So from my head, heart, and gut, thank you to that anonymous donor. I understand we had some audio situation in the beginning of this. So again, it didn't come across. Today marks the 79th anniversary of the tragic Pearl Harbor. We always must remember and never forget the greatest generation which saved America and saved our world. So I want to make sure that gets in. I will now bring up the Superintendent of the Springfield Public Schools, Dan Warwick, for his update. Subsequently, right after Dan, I will bring up Director of Facilities and Parks Management, Pat Sullivan, who will show you a video that will piggyback on what the Superintendent has to say on our reopening plan. Superintendent Dan Warwick.
Thank you, Mayor. Good morning, everyone. An update on our meals program. Since school closed down in March, we've provided 4,681,786 meals for families. This weekend alone, we provided 102,032 meals. We have a lot going on right now talking about school reopening, and as you know, school committee makes a decision on school reopening. In order to get significant input from the public, we're going to have a town hall on December 15th. Last time we did the town hall, we had over 5,000 people participate, and we provided information and took feedback in 6 different languages. So we're planning that again, and then the school committee will be making a vote on as to which reopening plan we'll be adopting on December 17th. As we speak, we're working very closely with Patrick Sullivan and Helen Colton-Harris, our public health director, relative to looking at the ventilation in our buildings and adopting a plan to upgrade the ventilation systems in our building so that we'll be ready to reopen in a safe manner for our students and staff. Just as a reminder to the public, flu shots are going to be mandated to re-enter school, and they become a requirement on January 1st. Last Thursday night, school committee took a vote to adopt winter sports. The season is delayed this year. Usually it starts right after Thanksgiving, but we're not going to start till January 4th for practice and January 14th for the games. And the sports that we'll be participating in Springfield will be basketball and swimming. Just as a reminder to the public, we have a helpline for anyone who has any issues with technology for the parents to access, and it's on our website. Since we opened school, our faculty has done a great job reaching out to families, and our average daily attendance in the online classes is 91.5%. So that's congratulations to the staff for doing a great job with that. As you know, we sustained a ransomware attack. We got hit with a malware system, and some of our information in some secondary systems was compromised. We notified staff that anyone who potentially had information compromised, that there was that potential there when we were providing them with free credit monitoring. They weren't able to access our main systems, but they were able to get into some secondary systems, and out of an abundance of caution, we've notified staff and again are providing that credit monitoring. The commissioner has been talking about potentially delaying the Mcas administration that was going to occur in January and the access testing. So it looks like that's going to happen, and that'll be a positive, so we're not trying to deal with that as we're experiencing this heavy surge in the virus rates. As you know, the commissioner, it was played in the press, did a letter to Boston, Worcester, and Springfield encouraging us to bring our special ed, our high-needs special ed kids back into school as soon as possible, and the school committee will be taking that into consideration as we make a decision on when and how to reopen. But again, the school committee has wanted to fix the ventilation systems before we bring anyone in, because our high-needs special ed students have the highest rates of pre-existing conditions. So we want to make sure that our environment is safe for all before we bring anyone back in. And I just want to thank Patrick Sullivan, who's been working tirelessly to provide the systems we need to make sure the ventilation systems are up to speed, because we have 57 buildings, and 3 of the buildings were built in the 1800s. So needless to say, they need a lot of work relative to ventilation to be safe for our kids in an environment where COVID exists. And Pat's going to give you an update on some of the work that we're doing with those ventilation systems. But I'm very, very grateful to Pat, Helen for all of her support, and the mayor in upgrading all these systems, so we're providing a safe environment for our students and staff. Thank you.
Thank you, Superintendent Warwick. Thank you, Superintendent Warwick. I'm now going to divert a little bit, I'm going to bring up Pat Sullivan, the Director of Parks and Facilities Management. I know George Rooney's here from IT. Pat wants to show, it's about a 3-minute video to show how sophisticated we are going to be to tackle this ventilation retrofitting of our...
Sorry, Mayor.
Director Pat Sullivan.
Sorry about that, Mayor. Coming up too fast. Last week, the mayor received a letter requesting a plan from the Commonwealth requesting a plan from the city about reopening the schools with a concentration on reopening sped classrooms. And the Department of Parks and Buildings is recommending to the mayor and to the school committee that not to reopen schools until the science and technology have been installed. And I'm going to share a brief video on the Iwave. 2 weeks ago, we had the OptiClean unit that was here, but I just want everyone to take a moment to see what the Iwave will do, and I'll have a little follow-up comment from that. So George, if you're ready.
How important is clean, breathable air to the health of patients in hospitals, to the learning capabilities of students in schools, to the productivity of employees in businesses? New Calgon's Iwave Air Purifiers address the needs in these and other commercial buildings by operating in facility HVAC systems, cleaning the air as it circulates. Iwave's patented technology uses needlepoint bipolar ionization to create a precise electrical charge that safely cleans the air, effectively killing mold, bacteria, and viruses. Iwave also reduces allergens, odors, smoke, static electricity, and airborne particles, as well as aids in keeping the indoor coil cleaner. Iwave's technology generates the same ions as nature creates with lightning, waterfalls, and ocean waves without developing any ozone. When these ions are injected into the airstream, creating a plasma region, they break down passing pollutants and gases into harmless compounds like oxygen, carbon dioxide, and water vapor, neutralizing odors without producing any ozone or other byproducts. The harmless ions created by this technology attach themselves to allergens, smoke, pollen, airborne particles, and more. When this occurs, the particles continue to cling to each other until they are heavy enough to be moved by the air current and caught by the air filter, resulting in a reduction of airborne particles that can cause respiratory problems. When the ions come in contact with viruses, bacteria, or mold, they remove the hydrogen atom from the pathogens. Without hydrogen, the pathogens have no source of energy and will die. A simple demonstration shows how Iwave prevents mold from growing on bread over time. This shows how the products address pathogens downstream of the device, at the coil, and in the living space. Another demonstration shows how Iwave products remove smoke from the airstream within a short period of time. New Calgon offers a complete line of Iwave air purification products. For commercial buildings, hospitals, schools, restaurants, and offices, the Iwave C is a self-cleaning, no-maintenance air purifier with universal voltage, programmable cleaning, and an integral alarm circuit. The Iwave C is suitable for 12-ton systems, and multiple units can be applied to larger systems. It has a waterproof housing and can be installed indoors or outdoors. Unlike ionization created by PCO technologies currently on the market, Iwave products effectively purify the air in buildings without producing any harmful byproducts or needing ongoing expensive replacement parts. Remember, only Iwave air cleaners safely treat the air so patients, students, and residents can live and breathe better. Iwave, only from New Calgon.
Yeah. So, as you heard in there, for the particles that are viruses or bacterias, it removes the hydrogen atom, and then that's what kills the virus. Or it creates them to be heavy enough where the filtration system will capture it. So when the mayor got the letter and I saw the report on the news, and I understand the need to get students back into school buildings, and I understand the sacrifice that parents are making and having to have their children taught at home, I just can't consciously recommend that we put anyone in a building of more than what the state is calling for. I think it's 10 people in a building at a time until this technology is installed in our buildings. We have other buildings that have the univent systems. Those have to operate on an increased airflow. We are installing the MERV 13 filters in those as we speak. And we're going to be getting the OptiClean units, which has a MERV of 20. Those will be going into the 4 older school buildings. And that technology has proven to be successful to, again, trap that virus or bacteria onto the filtration system. So I think the answer is very simple for the Commonwealth of Massachusetts to understand that the city of Springfield will be taking all the necessary precautions before we bring a great group of people together in one building, because we want to ensure the safety of not only the staff, the students, but we also understand the surge that we're under. The federal government announced yesterday this will be the worst crisis this nation has ever faced. So it's really unconscionable, in my opinion, that we're getting letters like this at this time for answers other than we will respond, and we are doing everything, but we will not reopen until we can ensure the health and safety of everyone involved. Thank you.
Thank you, Pat. Thank you, Director Sullivan. Well put. We all have the same goal, to get our students and staff back as soon as possible, but that soon as possible must be dictated through public health and safety measures. And as soon as we're able to do that, we will meet and exceed that goal, but not any time sooner. So DESE will receive a very detailed plan. You could see the millions of dollars that my administration is investing for the short term and really the long term in all our public schools and all our public buildings. So once again, we'll be ahead of the curve. So thank you, Director Sullivan and Superintendent Warwick and team, and Commissioner Helen Carlton Harris. With that, I'm going to bring up the Department of Public Works Director, Chris Signoli. I saw his men and women Saturday as they at DPW headquarters to wish them well as they were prepping for a storm. Thank God we really did not get hit hard, though we had prepped with the treatment of the roads, and we want to be prepared. Again, Director Signoli and I want to thank our residents and business community. They're a bit short-handed. We will continue the yard waste pickup and leaves, weather permitting. That will continue on until when the weather stops that. And again, we are in need of snowplow drivers and drivers. This is a phenomenon that is going on throughout the Commonwealth of Massachusetts. Without further ado, the Director of DPW, Chris Signoli.
Mayor, thank you very much. As the mayor mentioned before, the DPW has 3 employees out with COVID. Over the past 6, 7 months, we've seen a dramatic increase in the amount of trash, recycling, and bulk material that is being put out. We've modified our resources to make sure that all trash, all recycling gets picked up on its day. We were starting to have appointments out 4 to 6 weeks with regard to bulk. That was modified last week, so hopefully we will see a reduction in the amount of time, the lead time that people will be receiving for bulk appointments. With all that, what has kind of suffered has been the yard waste. We are a little less than 2 weeks behind. Excuse me, we are picking up Tuesday B week today. We will be on Wednesday and Thursday, and just as a point of interest, Friday last week, or where we should have been picking up last week, was in the Forest Park residential areas. That area, which usually takes us a day, was 3.5 days, simply due to volume that's out there. As the mayor mentioned, we are still taking applications for snowplow drivers in the city. The applications are on the website and DPW and with procurement. Our winter moratorium for construction is due to end this week, but depending upon weather, we may extend it for another week. And I believe that is it, Mayor. Thank you very much.
Thank you, Director. Thank you very much, Director Signoli. And now again, City of Springfield's in the business of doing business, and Chief Development Officer Tim Sheehan and his team have done a very, very good job in looking to stabilize businesses and also to assist our residents with their mortgages and their rents and the utilities and taxes moving forward. So we'll continue that balancing act until we will defeat this COVID-19 so we can rebound quickly. Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mayor. The good news I have this morning is that Bank of America economists last week projected that the U.S. economy will likely recover from the pandemic starting in 2022. While that's sooner than previously predicted, there remains a lot of household and business economic pain between here and there. As the mayor reported last week, the City of Springfield deployed in excess of $8.4 million of its CARE Act assistance to combat the economic, health, and housing insecurity that so many Springfield residents have experienced and businesses have experienced due to the pandemic. Our resources are quickly dwindling and the need for assistance is surging. The funding that we have put forward to date, $1.1 million in critical COVID-related public services, $2.2 million in direct economic development assistance to small businesses, and $5.1 million in emergency housing assistance and programming. Hope for additional federal resources is no longer a sufficient response as the evident need for them grows daily in Springfield and across the country. Thank you, Mayor.
Thanks, Tim. Thank you, Director Sheehan. You already received the financial report I gave from CAFO, TJ Plant, and HR, Labor, and Legal, Law that I gave you briefly from Attorney Bill Mahoney and City Solicitor Ed Pakula. With that, I will now open it up for questions of cabinet heads and/or myself. Paul?
Okay, question for Pat, I guess.
Director Sullivan, please.
Yes.
What's the time frame for getting all 57 school buildings retrofitted so that they can safely reopen?
Yep, the Iwaves are coming in this week. The last of the OptiClean units will be in next week, and we're going to probably need about 2 months to get everything properly installed and calibrated. And we're having meetings with Eversource this week at some of our older school buildings that are going to need increased electrical. So we don't have a complete timeline, but we're working with the superintendent for some answers on that probably by the middle of next week.
You said 2 months.
At least 2 months, yes.
Okay, so that would pretty much negate the second marking period as far as going back to in-person learning.
Yes. So it's a lot of equipment, it's a lot of technology, but it's going to be invaluable to wait for it to ensure the safety of everyone.
And what's the cost of all this?
It's over $1 million.
And that includes the upgrades, the electrical upgrades?
We're still putting that budget together as we speak, so I'll probably have a better number for you next week once we get those quotes in.
Thank you.
Yep.
Thank you, Pat. Thank you, Director Sullivan. Any other questions or comments? Okay, hearing none, again, I want to thank very much all the media members that are here, from TV to radio to print. It's important that this information gets out from the specialists and the experts, because we're going to look you straight in the eye and tell you the good, the bad, the ugly. As I opened up, I want to close, but before that, I want to thank the residents and the business community of the City of Springfield for your continued patience, understanding, and collaboration We will defeat this COVID-19. There is light at the end of the tunnel. The old adage of storm clouds, the sun comes back out. We're in storm clouds right now. So we need you to wear those masks. We really need you to rethink how you're going to spend your holidays with your loved one or close friends. If you have not been around them, you can't do it. You just can't do it. You see the massive numbers this first week of December, 904 cases. At that rate, that means in December it will be well over, probably over 4,000 on that. I also want to thank my cabinet heads all the way down to rank and file who have been tested and true through a number of natural and man-made disasters. You can't put a price tag on experience, and I appreciate their efforts, and I appreciate their families' efforts, because many a times we are taken away from our families to make sure we're able to provide for each and every one of your families. And as I opened, I will close. We're in the holiday season. Hope. Hope makes people believe. Hope moves people. Hope makes people do. I'm asking you once again to do. We need it more than ever. So go out, be careful, good health, and have a great day. God bless. Thank you.